But first, each year, an estimated 2 million people suffering from mental illness are booked into county jails. Police, emergency responders, and courts are all looking for better ways to handle these individuals, in some cases by diverting them from the criminal justice system in the first place. John Yang recently visited one such effort in Kansas City, Missouri, part of our ongoing series on broken justice. This story was done in partnership with the Pulitzer Center on Crisis Reporting.
Mr. Gravely, Bridgewater, come forward, please.
Wednesday morning in a Kansas City courtroom.
Here, sir, you're entering a plea of guilty to a shoplifting matter.
Inmates from the county jail appear before a judge. One man seems agitated, refusing to cooperate. Then, as another inmate's sentence is handed down,
I will impose a sentence of 90 days in city jail.
Hey.
Typically, the people that we see on the custody docket, they have just a complex array of problems. It's not just behavioral health, not just mental health and substance abuse issues, but also homelessness, a history of trauma, no family or social supports whatsoever, no job skills, no social skills. They'll cuss at me in court.
Joseph Locascio is the senior judge on the municipal court bench.
If the conditions of probation are followed, Mr. Stokes, then at the end of the year, the case is closed off your record.
He estimates that as many as a third of the defendants in custody who come before him have some sort of mental health issue.
It's pretty much obvious to everyone in court. These are not people that it's hard to determine what's wrong because they're saying nonsensical things, and their lawyers like going, I don't know what to do here, and that's sort of symbolic of the entire community. We don't know what to do here.
This is where many offenders with drug abuse problems or mental health issues end up, the county jail. But here in Kansas City, like in other places around the country, they're looking for a better way to get those people the help they need and back on their feet.
He was staying in an abandoned house.
The next morning, community health worker Cheryl Reed and Kansas City police officer Eric Anderson searched for a man well known to police.
The number of police contacts triggered us to go out and see him because there's enough reports made on him detailing that he was mentally ill that we had a basis to talk to him.
Their first stop, an abandoned house where he often stays.
He told us when we had contact with him on Tuesday, he said that he would like us to take him to one of the community mental health centers.
Anderson is part of the police crisis intervention team, trained to deal with those suffering from mental illness and substance abuse disorders. The goal is to intervene before minor violations like disturbing the peace, trespassing, or public drunkenness land them in jail.
So this is crime prevention.
It is, but it's a non-traditional crime prevention.
They come up empty and move on to another case, a young man Anderson first spoke with a few weeks earlier.
He is starting to have delusions, probably his first psychotic break, that his mom is putting cameras up in his house to watch him.
They meet him at a convenience store near a community mental health center. He'd tried to get an appointment there, but was told he'd have to wait until June.
I will drive you. There's the crisis center's right here on Prospect.
So he agrees to come here. The Kansas City Assessment and Triage Center.
Okay, so we'll stop right here again.
This crisis center opened in late 2016, funded by the sale of 2 nonprofit hospitals, along with money from the city, local hospitals, the Missouri Department of Mental Health, and the state legislature.
Come on back with me.
Before, police and other first responders essentially had 2 options when dealing with someone suffering from mental illness or drug abuse: the jail or the emergency room. Stephanie Boyer is the program manager.
The idea was to create sort of a no wrong door, particularly for police officers, where when they're not sure really what's going on, they had a place that they could bring people and they could be evaluated, and we could kind of see what's going on and see how we could help them, what kind of services they might need to get into, if they need medications, things like that.
3/4 of the patients are homeless men. Most have both mental health and substance abuse disorders and no insurance. Here they sober up, have a meal, sleep. Nurses and counselors fill in gaps in their mental health care, directing them to the help they need. It's all voluntary. They can leave anytime they want. They have to leave after 23 hours, a limit that allows the center to operate as an outpatient center and help as many people as possible.
Everything we do here is to really bridge them into whatever that long-term need is. And so we'll continue to provide whatever it is that they need during that time. You know, whether it's medications, case management, housing, you know, whatever it might be. Working with an employment agency if their goal is to get a job, you know, whatever it might be for that person.
After leaving, caseworkers follow up on those needs, in many instances helping place them in transitional housing, a critical need.
I was worthless on them streets. I mean, I don't know the words. One officer called me bottom feeder. That hurt.
61-year-old James Butler says he spent nearly 35 years on the streets, drinking and using cocaine, suffering from undiagnosed schizophrenia. About 10 months ago, a police officer picked him up. Butler assumed he was headed to jail again.
The next thing I know, I'm pulling up at 12th and Prospect at Crisis Center, which I didn't even know that's what it was.
After being evaluated, a caseworker directed him to a bed at Benilde Hall, a sober home for men.
I drugged myself in that gutter, what I call a rut. Well, now I've quit digging that rut. I'm kind of slowly filling it back in, and it feels good to have people smile at you instead of step out of the way. It really feels good. And I couldn't have done it, I'm not going to kid you, without this place, without help.
Good girl.
Not far away, Cassie Leeper has a house, a job, her 3 boys, and a puppy. A year ago, things were very different.
I had a big mess. My kids were taken by DFS and in foster care. I was facing prison and court cases in different counties and all of that stuff.
Addicted to methamphetamines and suffering from depression, she went to the only place she knew.
And I went to the emergency room at Truman Medical Center and told them what was going on and everything. And I had actually been to an emergency room prior to that, and they couldn't do anything. And they actually paid for me a cab and sent me to the crisis center.
Is this the right place for those people?
If they're having an acute emergency, an acute, mental health break, then yes, we're equipped to deal with that and equipped to take care of them.
Emergency room physician Kevin O'Rourke works the overnight shift at Truman.
For most of the patients, these are chronic problems that need intensive resources, need case management, need housing, need help with their medications. And the emergency department, we are ill-equipped to kind of help those chronic problems.
O'Rourke also points out that ER visits are very expensive. Sending people to the crisis center instead could reduce costs by 50 to 75%. It's too soon to know whether Kansas City's crisis center is actually saving money or reducing the number of people receiving care in the county jail or emergency rooms. In some ways, it is highlighting the extent of the need, the big cracks in the long-term mental health care system. Already, critical funds that allow caseworkers to place people in transitional housing, get medications and follow-up care, have been cut in half by Republican Governor Eric Greitens.
But all those funding streams are in jeopardy. So it does come down to a matter of showing statistically that we're helping this population, keeping these people in treatment and out of the judicial system and out of the hospitals in order for those funding sources to continue.
They'll be placed on the docket.
Everyone we talk to, the judge, the doctor, the police, the head of the crisis center, the patients, say treating people with respect is key to changing behaviors.
That's what turns people around, like me, is finally seeing that people out there do have a heart. And I found out, I'm still searching for who I am, because I never knowed me. I have never been clean and sober, or wanted to be. I mean, it is amazing. It puts a smile on my face every day. And I've got a future coming.
One that he and those helping him hope is far different from his past. For the PBS NewsHour, I'm John Yang in Kansas City.